Are your eyes red? Do they feel dry and even more so when staring at the computer screen at work? Are you tired of rubbing them all the time because it feels like there's something in your eyes? You ask several of your colleagues at work if they've experienced similar symptoms with their eyes, and they tell you that you may have dry eyes. And the obvious cure for dry eyes is to wet them, of course. So you run to the nearest pharmacy and discover there's not just one or two brands of artificial tears. There are dozens upon dozens of them, emblazoned with green, blue, white, black, red, and the whole kaleidoscope of colored boxes promising relief from your dry eye symptoms. You pick the closest and cheapest box of artificial tears, but suddenly remember your mom always told you that you get what you pay for, and you pick the most expensive bottle on the shelf and head to the checkout counter. Having paid 5 times as much for this new bottle of artificial tears, you're quite satisfied relief is at hand, and wait until you get into the car before using it. It does feel better, and start the car to drive home. After about 30 seconds, as you've entered the ramp onto the freeway, your eyes start to burn and sting again. But you're too hungry and exhausted to return to the pharmacy. After dinner, but your eyes still feel dry, and you head off to bed hoping sleep will solve what the costly artificial tears could not. After 8 hours of sleep, the alarm rings, and you wake up only to see that your eyes look redder and feel drier than yesterday. There's even some yellow-white mucus secretion at the corners of your eyes. You think your eyes may be infected and call your boss to tell him that you need to see a doctor and won't be able to make it to the office today. After seeing a doctor, you're given 2 prescription eye drops that cost 10 times more than the most expensive artificial tears you bought yesterday. Surely these drops must work, since they cost more than an airline ticket. After using the drop for a few days, your eyes feel no better. There must be a better solution for your eyes. There is. Zocular. Stop pouring eye drops that just don't work well into your eyes. More than 85% of dry eye symptoms are caused by eyelid diseases such as blepharitis and Meibomian gland dysfunction, or acne of the eyelids. In other words, it's the dirt, oil residue, bacteria, and debris around your eyelids that get into your eyes and cause them to become inflamed and irritated. Dry eye is almost always not due to a lack of tears. This is why artificial tears rarely work. Zocular is not an artificial tear. Zocular is a transformative ochre-based innovation that addresses the source of your dry eye symptoms. Zocular incorporates the restorative and rejuvenating properties of ochre to harness the power of nature, gently cleanse the eyelids to help inhibit the cascade of irritation and inflammation that can lead to dry eye symptoms. Zocular Wipe is an advanced natural formulation that can be used just once a day for immediate relief that lasts from morning to night. When it comes to your eyes, trust the brand that doctors and healthcare professionals trust. Zocular is once-a-day formula, dermatologist tested, hypoallergenic and non-irritating, pH balanced for tears, soothes moderate to severe symptoms. For your dry eye symptoms, don't be confused with the countless treatment options. There's only one natural choice, Zocular. Experience the healing powers of nature with Zocular's ochre-infused solution, the clarity of vision,